A Tri-Cities man who went to the hospital late last year for hip repair surgery left the operating room with a broken neck. The reason, after surgery, he was dropped on the OR floor, sustaining injuries that later claimed his life.
He was a happy person, and he was good to everybody.
Something family says did not change even when Alzheimer's disease robbed 80-year-old Harold Landers of his ability to live at home. At a nursing home last November 7th, Landers fell and broke his hip. Bertha Landers says a doctor at Laughlin Memorial Hospital in Greenville told her surgery was her husband's best option.
I had hope of him being well enough to go back to the nursing home and well enough to be taken care of and live no telling how many years.
Right after surgery, the Landers said the surgeon had good news.
He was telling us the surgery went well and how things would be afterwards. And the doctor looks down at his phone and he said, "I've got to go." He said, "I'll be back in a few minutes."
When the surgeon returned,
Dropped his head. He said, "I don't know how to tell you all this." But he said, "They dropped Mr. Landers and they have broke his neck."
a physician's note just hours later says that during transfer from the OR table to bed, the patient was dropped.
It was kind of just utterly disbelief, you know. I mean, who gets dropped in the operating room, you know?
A CT scan revealed a fractured vertebrae at the top of his neck and a subdural bleed in his head. So Harold Landers was airlifted to the trauma unit at Holston Valley Medical Center in Kingsport. Family photos show Landers in a halo brace to secure the spinal fracture.
And they had the screws in his head. That's hard.
Family said he was on life support and never regained consciousness. 8 days later, Harold Landers died. Back at Laughlin Hospital, now called Greenville Community Hospital East, hospital owner Ballad Health said Landers' fall triggered rapid same-day action, including staff meetings and retraining. 6 days later, the Centers for Medicare and Medicaid Services launched an investigation. Through a public records request, News Channel 11 uncovered this 80-page report that details the federal agency's investigation. As Harold Landers was being prepared for transfer from the operating room to the recovery room, the report says 4 hospital employees struggled with what's called a fracture bed, similar to the one in this image provided by Ballad Health. The chief nursing officer described it as technical difficulties, saying there were no safety straps used for the patient during the procedure, and the post was removed from in between the patient's legs prior to the bed assembly for transfer. And there was miscommunication between the providers as to who was monitoring the patient.
There were several things that came together all at the wrong time that allowed this to happen.
Dr. Mark Patterson was chief medical officer at Laughlin at the time of the accident. He's now president of Ballad Health Medical Associates.
The patient during that period of time was waking up from anesthesia. During that event, while they're manipulating the table, he rolled and unfortunately came off of the table and impacted the back of his head and his neck.
The inspection conclusion, the facility failed to follow facility policy and failed to ensure a safe environment during a surgical procedure. The next day, CMS declared immediate jeopardy at Laughlin Hospital, its most serious sanction, meaning the hospital's noncompliance had caused or is likely to cause injury, harm, impairment, or death.
This was not an equipment malfunction.
It was not equipment malfunction.
This was human error.
It was human error that needed to be assisted through better training on a piece of equipment they may not have been as familiar with as we had hoped.
Records show Ballad Health's action plan led CMS to remove the immediate jeopardy status the next day. Since then, Ballad said it ordered a safety review of every fracture bed at all its hospitals, with strict oversight to continue for the next year.
Do you feel that plans are in place now to make sure that what happened to Harold Landers doesn't happen to anybody else?
I do. the whole team's devastated at the chain of events that occurred.
Harold Lander's death certificate lists the cause of death as acute traumatic spine fracture related to a fall in a healthcare facility.
It wasn't supposed to be that way. Nobody should leave this world like he did, like he had to. He could have still been here today.
The Landers family and Ballad Health have been negotiating a settlement for the past several months in the case. This morning, the attorney for the Landers family said a settlement had been reached. The terms are confidential, but through their attorney, the family released this statement. They said in part, Ballad Health says their mission is to honor those they serve. Their actions since this incident have shown they are living up to their mission by honoring our father and husband and minimizing the chance an accident like this would happen in the future. They said Mr. Lander's story is important because it can be used to help others. While greatly saddened by the result of this accident, the family is grateful Ballad is trying to turn it into something to learn from. You can read the entire statement on WJHL.com.